8 years into owning him, he had all these health problems. He was putting on weight, his shedding like crazy, his joints were aching. And a friend of mine said, well, why don't you put him on a little bit of testosterone? I had him clipped when he was younger, neutered him. So I started giving him 10 to 20 milligrams of testosterone a week. Everything changed.
What's up, guys? Derek, moreplace.com. Today we're going to be talking about this guy off the True Off My Chest subreddit. He got some attention when he talked about his experience giving a deer some Dbol. Yeah, I gave a... How do we even find this shit, dude? I gave a deer quite a bit of steroids is the title of the thread. I thought of this today after seeing a deer. I never told anyone or got feedback, so what the hell, right? A while back, I had a deer buck I used to feed. I got pretty close to him, both physically, could pet him, but also emotionally. He was like my dog, basically. He was maybe a year old when I met him. Anyways, when the rut started, I was worried he'd lose his territory to bigger bucks and I wouldn't see him again. So I put him on 10 milligrams twice a day of Blue Heart Dbols. So if you know the Blue Hearts, those are like, you know, when you were trying to find underground lab Dbol, it was like, yeah, if you found that, you were like, damn, this is the good shit. Or like the pink Tide Dbols, you were like, fuck yeah, dude. I'd put the tab in his apple slices, and he always ate it. I'm not shitting you, he bulked up fast, as you would expect, using fucking Dbol. He also seemed the most aggressive of all the deers out there. I watched him have some pretty epic battles against other bucks out in the yard. Enhanced, of course. He was glorious, but alas, one day he disappeared and for like 2 years I never saw him. Then one day this massive, beautiful buck comes walking down the street, looking around sort of out of place, and I knew it was him by the look of his face. So it seems like he kept his gains with no PCT. With no PCT. I made the noise I used to make to call him. I made the noise I used to make to call him, and he came right over and let me grab his impressive antlers. I never saw him again though, but a few years later I saw a young buck, maybe a year old, and he had the exact same handsome face. I knew that was one of his offspring, and I thought to myself, that's awesome. I still miss that deer. He probably died by now of old age, but his lineage continues to this day, I'm sure, and I like to think I had a helping hand in ensuring that. So obviously didn't inhibit his fertility either. Go figure. Rambo plus Bambi equals Rambi. That's Rhino from Donkey Kong Country. I think there's a joke called Deer Hunter where you played a steroid ripped deer with a gun hunting hunters. It was pretty absurd. Someone needs to draw this. My wife and kids kept asking me what the hell I was laughing at, but I was laughing so hard it took a minute to answer them. You deserve to be named in a book somewhere for the comment. This is the most chaotic good thing I've ever seen. This is what happened to the car after your steroid buck was hit. And here's your steroid buck with his son after the collision. Holy shit, dude. You did what now? Now, besides the deer's drug intake, what drugs are you on? The good ones, also some of the bad ones. I'm taking a shit break at work. Thanks for the read. Okay, so this kind of evolved into this weird subcategory I was thinking of as gear, pets on gear, which is interestingly something that came up on the, I believe it was the Joe Rogan Experience.
8 years into owning him, he had all these health problems. He was putting on weight, his shedding like crazy, his joints were aching. And a friend of mine said, well, why don't you put him on a little bit of testosterone? I had him clipped when he was younger, neutered him. So I started giving him 10 to 20 milligrams of testosterone a week. Everything changed. His appetite came back, he stopped shedding, he leaned out. And I asked my vet, I said, what's the story here? And she said, there are a lot of things that we could do to make animals' lives better that we don't. For instance, hormone therapy, give them cough medication.
But wait a minute, why not just not have them clipped?
Well, I didn't think of that. I was too late, and you can't put them.
So many doctors are they're so eager.
Did you clip Marshall?
No.
Okay, so you're ahead of the curve because.
Well, I had a great doctor. I had a great doctor in Los Angeles that told me, he said, there's no reason to do this. He goes, look, people don't want unwanted puppies. He goes, but you're not letting your dog just run around and breed with things.
But he was talking about his dog and neutering of pets and the subsequent effects that it has on their well-being, quality of life. Similarly to a castrated hypogonadal man, you would expect, why would you expect differently in pets? It's kind of interesting because it's like pets will get neutered and then people don't understand why. I don't know, they just like don't even consider the impact it could have on that pet's quality of life whatsoever. It's like, we just don't want you to fuck, so peace out, balls, you know? But in reality, this can, imagine walking around with your nut snipped as a guy. Like, how would you feel? Probably pretty fucking terrible. The same thing goes for pets. This thread was an interesting side tangent. Should I start my dog on TRT? Question mark. How TRT can benefit your neutered and spayed canine patients and offer a new revenue stream for your clinic. By the way, Merrick does not currently do dog TRT, but I am like very open to like learning more. Like, it's fucking interesting, and I think it makes a lot of sense. If you had a neutered dog, he's gonna be quite docile and fucking not happy if he's neutered and he feels like shit and is hypogonadal, walking around with no goddamn testosterone production. Dogs who have been neutered typically have very low test levels, less than 0.1 nanograms per milliliter, and may experience side effects due to the reduced levels. If you notice that your patient has trouble getting up, has reduced muscle mass, or is knuckling his paws after being neutered or spayed, he may be experiencing side effects from reduced testosterone levels. Other side effects of reduced tests include hip dysplasia. So again, like bone mineral density, androgen dependent, estrogen dependent too. This is something that's going to be degenerative in a expedited manner if you have no hormone production, obviously. Arthritis, intervertebral disc disease, or degenerative joint disease. These side effects can be reduced with testosterone replacement therapy. Like, think of when women, trying to say fucking women, go through menopause. How many things go awry? All of a sudden, you know, Alzheimer's risk goes through the fucking roof. The cardiovascular disease potential goes through the roof. Muscle mass, bone degeneration, all these things that deteriorate as a result of lack of hormone production. And for men, this is a more steady decline, but it happens quite precipitously too as they get into, you know, 50 plus years old, losing like 1+% of free testosterone levels per year or something ridiculous. So again, if your dog is like crushed to fucking zero, you can just imagine he's going from like healthy, functioning, happy to literally like hypogonadal, depressed as shit overnight and like ruining their life essentially, in my opinion. And that's where TRT would make a lot of sense, probably. These side effects can be reduced with TRT, which increases test levels in dogs back to normal levels, restoring healthy muscle mass and bone density, as well as increasing quality of life. The benefits of TRT are significant and side effect free. I don't know about that, but I've conducted, it's probably better than having a hypogonadal fucking castrated dog though. I've conducted 3 clinical studies of TRT and found an increase in quality of life in over 140 canines with a 95% success rate in my most something. Okay, anyway. Hey, I need you to do a little research. Do they inject the dogs there, or do they trust me to take the vials home for my 13 dogs? Holy shit. Sir, my dog says he has no issue pitting frequently, would rather have more stable levels. Can he get test E? What? Sir, my dog says he has no issue pitting frequently. Clearly, I'm either like too underslept right now to read this correctly, or this makes no grammatical sense. My dog says he has no issue pitting. It's like, my dog has no issue pitting. Like, imagine your fucking neutered dog is like, I'm gonna be fine. I'm just gonna pin every day. It'll be stable blood serum concentrations, no aromatization issues, no 5-alpha reduction issues. I will not need an AI. I will not need a 5-alpha reductase inhibitor because I will maintain a steady pinning schedule. Legally, you can keep 6 month supply. No officers, that's my dog. No officer, that's my dog's drugs. That would go over well. Fuck, dude. Imagine you just have like a script, it's like on the name on it, it's just like a Rusty or some shit. Nah, man, that's dog trend. Way different. Dog is about to have some weird dreams. I swear none of you have actually run Trendball. I never have weird dreams on it, and I'm on it right now. I never have. Those trend stories scare me off. Put my pit bull on trend. He got shot by the police after mauling 2 people. Should have taken him on the bus to fuck fat bitches. Cops are so rude. What the fuck? Well, woof woof, bitch. I'm in. Mike Vick is hyped. You guys laugh at, this is the thing I was talking about. You guys laugh at Andrew Huberman notices dog being lazy and starting to have joint problems after being neutered. So put his dog on a TRT regimen. He said his dog came back to his old energetic and happy self afterwards. You see the impacts of low test in humans. Why would it be different for a dog? I personally rather not neuter for this reason, but my dog is from a shelter and they snipped him before I adopted. So again, some people don't have, you know, their dog came neutered as is, or they just were not aware of this, because it's, you know, something that is, I don't know, even like snipping your kid's dick when he's a baby, like when you circumcise versus uncircumcised, like there's differing opinions as like new literature has come out over the years. So if 10 years ago you thought something else, and then, you know, 10 years later you learned something new, you know, like maybe you realize, you know, something was fucked up. And I'm not suggesting that circumcision versus uncircumcision is fucked up versus not. Everyone has their own dilemma, debate on that. It's a totally separate subject. Probably shouldn't even brought it up. But at the end of the day, like you might have not known neutering was bad, you know? It's not like they tell you, like, by the way, side effect of the shit could be he has no test and he like hates his life as a dog. You just, you know, some people just assume, oh, this just like takes care of a problem, but don't assume any of the consequences that could occur as a result of it. So even individuals as well-researched, intelligent, have accolades behind them, like Andrew Huberman. He's a neuroscience professor at Stanford and one of the fastest growing like science-based platforms, channels on, you know, social media right now, because of his high quality information, like insight into, you know, cutting edge literature and whatnot. Even he, you know, has done stuff that back in the day that he, you know, learned later was, you know, probably not the best thing to have done. Just like in even hormone use, like anabolic exposure. Like there's a reason why I make a lot of harm reduction videos now. It's about stuff I wish I knew when I was younger. And it wasn't that fucking long ago when I made those mistakes. Again, so just because an individual is somebody that is seen as like a, I don't know, a resource of information, like everyone's learning and no one is infallible. Everyone has, I don't know, lacks in, you know, their breadth of knowledge and whatnot. And everyone's continuously trying to learn new things. So it's not uncommon to end up in a situation where you might have, you know, done the wrong thing and you're learning as you go. And perhaps something like, you know, TRT is viable for a pet that has been neutered. So this video was another thread that came up. TRT for dogs, testosterone replacement therapy may help aging dogs. Veterinarian. My dog's gonna be on the blast and cruise lifestyle as soon as we get home. 500 tests and a sprinkle of VAR. My dog pins dry test daily. Gets VAR when he's a good boy. That's right. On his birthday. The reason we cut off their balls is to make them less aggressive. Also to make them stop humping everything. And you get obese ass low T having dog as a result. Yeah, so it's like, I don't know. It's like, should you even, this is an interesting discussion too. Should you even have a fucking dog if you're just gonna like castrate them? You know? It's like if I have a kid, imagine you had a kid and you were like, you're being a piece of shit. Stop being so irate. He's like, fuck you, dad. I'm like gonna be a piece of shit and like annoy you and be like a, you know, one of the worst behaved kids in the class and blah, blah, blah. And you're like, you know what? Fuck it. You just like strap him to the table and like snip his nuts off, and, like ruin his life. Like, is that the answer? It's like, you're being too aggressive. We gotta chop your nuts off, kid. So anyways, testosterone therapy in dogs. Let's check this video out.
Well, there are many science-backed health benefits of owning a dog. You have lower stress levels, more physical activity.
This is a pretty recent video.
Reduce risk of a heart disease. But for all that our canine companions do for us, there's
Okay, you know what? I can tell this is probably a channel that would copyright, so I'm just gonna not even gonna fucking watch. I think we kind of get the idea at this point that anybody who has crashed hormones is gonna feel like shit and not perform at their best. Maybe you won't feel like shit, but I would assume the likelihood is higher that your quality of life and actual health metrics certainly would be better if you did not have, if you weren't castrated. So anyways, let me know what you guys think. Interesting topic and discussion, and definitely something to think about. All the comments help the algorithm and much appreciated. Like, subscribe, check out my blog, moreplacemordates.com. Follow me on Instagram at moreplacemordates, Facebook, Snapchat, Twitter, TikTok, Apple Podcasts. If you want to support the channel, you can check out anything I'm associated with in the video description below, including my preventative medicine and hormone replacement therapy platform, where we connect you with medical providers who are staying on top of the most cutting edge literature in endocrinology and pharmacology. And maybe in the future, we even help fucking dogs, bro. We'll see. So if you want a high quality doctor that will oversee humans, including you, if you're a human, if you're not a dog that's watching this, learning how to pin fucking every day to avoid aromatization and whatnot, then you can check it out. You know, we stay very on top of the most recent literature and pride ourselves on educating our patients, you know, interpreting elaborate diagnostics, even getting into things like genetic predisposition through analysis, Dutch testing, things that are more cutting edge and are often overlooked, I think, in most hormone therapy practices who otherwise would just throw you on a cookie cutter protocol of TRT, HCG, and anastrozole. That's not what we do. We make sure we evaluate all lifestyle factors, dietary manipulation, like perhaps there is things that can be corrected that would otherwise prevent you from needing to get on TRT to begin with. That's stuff we all evaluate thoroughly at Merrick, and you can check it out in the video description below if you want a high quality doctor, or if you just want access to self-service labs at a cost-efficient price point with the most useful biomarkers, including pre-designed panels audited by myself that have the most important markers for assessing cardiovascular disease risk, liver health, kidney parameters, hematology, etc. So you can check it out as well. Gorilla Mind, nootropic formulas, Gorilla Mode pre-workout formulas. I designed myself from scratch, recommended diet for gaining muscle and sports performance whilst being mindful of micronutrient intake and gut health. Clothing company that sponsors me, anything else I'm associated with, it's all in the video description below. Thank you guys for watching. Talk to you soon.